Hello, I'm Dr. Anjali Bhatawdekar. I'm a pediatrician. Today, in our session on parenting, I'm going to talk about two important issues that parents are worried about for their children, and that is the child's weight and the child's height. Many parents worry a lot about whether the child is gaining weight properly or not, whether the child's height is okay or not. Before we go into the details of this, let us remember that the height and weight of any child are determined mainly by the hereditary factors, that is genetic factors. If the parents are tall and hefty, the child is going to be like them. On the other hand, if the parents are thin and maybe a little on the shorter side, even their child is going to be like them. So, these factors are something which we cannot change and you have to accept it completely. The other important factor is the diet. Whatever the child is eating, if the child has a balanced diet which takes care of all the important nutrients like the carbohydrates, proteins, fats and vitamins, then the child will grow normally. We see very often that many children whose hereditary factors are the same, the dietary factors are the same, but there is a lot of difference in their heights or weight. And this is when the parents start worrying. Let us look at some facts. After about the age of 2.5 to 3 years, a child gains 5 to 6 centimeters in height every year. And he also gains about 1.5 to 2 kgs per year. Sometimes some children who are very active may gain only 1 kilogram in a year. Now, when I talk about these things, many parents start calculating. Oh, okay, so this is 6 centimeters in 1 year. So 3 centimeters in 6 months. So it's going to be so many centimeters in 1 month. And they start measuring the height of the child every week or every 15 days. And then they are disappointed and frustrated when there is no increase in height. With height, something else you must remember. Whenever we say that the height increases by 5 to 6 centimeters in 1 year, it is not necessary that it's going to increase slowly every day. There are spurts in the increase in height. There are periods when the height increase is maybe 2 or 3 centimeters in a couple of weeks. And the next 2 or 3 months, the child is going to be static in his height. And again, there will be another spurt. So the total increase in height would be about 5 to 6 centimeters in the whole year. If we remember this, we will not get unnecessarily anxious. Some parents demand tonics for their child. They say my child is not feeling hungry and that's why his weight is not increasing. So give him some tonics which will increase the appetite. Please remember that the so-called appetizers are most of the time, or tonics, they are most of the times vitamin B complex. Now, there is one peculiar thing about B complex vitamins, and that is if we take excess of vitamin B when it is not required for the body is going to throw it out into the urine. So, if you are giving vitamins to a child who doesn't need it, it's as good as throwing the tonic bottle or the vitamin bottle into the sink. It's not going to be of any use at all. So, please refrain from using any tonics or appetizers for your child if your child is otherwise healthy. Now, some parents still worry that the child is not gaining enough weight. For these parents, I would advise that keep a watch on 3 things, only 3 things. Okay, the first and the most important is your child losing weight? Second is your child not very active as usual? Is he sitting down at one place, doesn't want to play? And the third thing is your child falling sick very often? If the answer to all these questions is no, then you don't have to worry. But let me elaborate a little on the illness part. Many parents will tell us that the child is falling sick very often, and when we go into the details of that, they will say that he has cold every week, or whenever the weather changes, he's having cold and cough. Now, this is not really considered as sickness by doctors. What do we consider as sickness? Okay, whenever the child is falling sick and is sick for a longer time, has high fever, needs to be taken to a doctor for treatment, and also misses school for the sickness. And this is happening maybe every 15 days, every 20 days, at least more than once in a month. So, if a sickness like this is happening often, you must of course take the child to a doctor, get him examined, do the necessary tests. But if it is only just mild colds and coughs, you don't have to worry about it. If the child is losing weight over a period of say 3 or 4 months, 6 months, then that's something to worry about. But of course, if a child has fallen sick, say he has diarrhea and he loses maybe a kilogram or so during the period of diarrhea, but he will gain it back in the next 15 days, 20 days or so. So that is not called weight loss. Weight loss will be considered only if there is a continuous weight loss over a period of time. If that is not happening, don't worry about it. And another important thing is the activity of the child. Remember that any healthy child is not going to sit at one place. He is going to be active, he is going to be playful. So if a child who is otherwise playful is now sitting in one place, that is a point for concern. So then you have to consult a doctor. So just remember these three factors. If the child is not losing weight, if the child is not falling sick very often, and if your child is active and playful, don't worry just about the numbers of weight. Your child is absolutely healthy.